I've been asked to speak today about school mental health as we restart school. And I should say that my heart really belongs in the schools. I served as a psychologist in the schools in Baltimore City for a number of years before the work that I do now, co-directing the National Center for School Mental Health. And I still am very engaged with our schools in Baltimore City and supervise a number of our social work colleagues and our psychology colleagues who are in our schools in Baltimore City and Prince George's County and throughout Maryland. And so I know that our mental health support staff in our schools are going to be critical as our young people and families face what, as Dr. Johnson said, is a critical time in our nation, both in terms of our young people's education, but also in terms of their health and mental health and well-being. So again, I appreciate the opportunity to speak to the topics today that have been laid out before us, and I'll share some resources, but I'm also going to ask you all to share some resources as I speak today so that we can learn from each other. Just for a moment, want to share the lens through which I see my work. So I'm housed at the National Center for School Mental Health. We've actually been around for 25 years now, and we are funded out of the U.S. Department of Health and Human Services. You can find out more about the work that we do at schoolmentalhealth.org. And as you see here, we're based at the University of Maryland School of Medicine in Baltimore. Here's where you can find out more about us. And as with many organizations, we have added a resource tab on COVID-19. And so if you are looking specifically for school mental health resources, including resources on restarting school, you can find some here. That being said, I know that many of us feel somewhat inundated by resources right now. And so we've tried to do the job of vetting and culling down some of the resources, but I understand that part of what is important right now is just hearing from your colleagues and others about what they have used and what they found to be successful. So I hope that we'll do some of that today. One other resource from our center that I want to share is it's called the SHAPE system. It is, again, funded out of HHS, so it's a freely accessible portal for any individual school team, district team, or state to go in and assess their school mental health quality. And at this point, we have users from across the nation, thousands of schools who are coming in and assessing how they're doing. And there's a large repository of resources, including an assessment that we developed with the National Child Traumatic Stress Network, looking at trauma responsive schools. And I know right now, many schools and districts are trying to better understand how they can be responsive to the trauma experiences of young people and staff. And so want to just share that resource with you, and we'll share some others as we go along. So now let's move to our topics at hand today. And I want to start with this quote that actually was in a recently released guidelines from SAMHSA, the Substance Abuse Mental Health Services Administration. So some of you may have seen this. This is a best practice toolkit that they put out, really encouraging the nation to transform our behavioral health crisis system for adults, but also for children and youth. And what they said as part of this report is that perhaps the most potent element of all in an effective crisis service system is relationships. To be human, to be compassionate. We know from experience that immediate access to help, hope, and healing saves lives. And I found this quite poignant as we consider the crises as we are facing as a nation, both COVID and also the rampant injustices of racism that are not new, but that are seeing a new day of awareness and uprising that we hope creates opportunity for change. And so as we talk about strategies and system change today, I want us to keep in mind that most of the change that we'll see will be based on relationships, and that compassion has to be woven throughout. And that includes compassion for ourselves. So we'll speak to that in a moment. As Dr. Johnson mentioned, today we're all going to be speaking about restarting schools in the context really of what many are calling two pandemics, two crises, COVID and the racial injustices that have been present in our nation. for centuries, and what schools and school social workers and educators can consider to respond to these two pandemics in a way that is most supportive of our young people and families. So what we know is that both crises are taking a tremendous toll on our mental health, including the well-being of our youngest members of society, our children, our youth. So we'll start with COVID. The impacts of social distancing, school closures, shelter in place and isolation, and disrupted routines alone are leading to increases in loneliness and grief, depression and anxiety, and the data is becoming more clear here, and trauma. And we also know that the devastating health and economic and social burdens on families right now are leading to significant family and community stress. And we're finding increases, unfortunately, in family violence and also in child abuse and neglect. And that is combined with challenges with reporting and support that many of you are familiar with, in part due to schools closing. We also know that racism and racial injustice has long-lasting effects on the health and mental health and well-being of Black, Indigenous, and other persons of color, or BIPOC. Some examples of racism are listed here, and I want to point to each of these because we know that they all take their own toll. So historic and generational racial trauma, the passing along of racial trauma through generations of groups. Institutional and structural racism that we certainly see in our education and health and mental health sectors. And then our individual acts of racism and microaggressions that people experience on a daily basis. And what we know, and there is a wealthy body of literature at this point that points to the added stress that these forms of racism take in terms of the health and mental health of our BIPOC young people and adults via what some call an ongoing individual and collective set of injuries. The research has shown us that experiences of racism at all levels lead to feelings of sadness, guilt, shame, increased rates of depression, anxiety, post-traumatic stress, and increased rates of substance use, long-term mental health, and health concerns. For example, we know that chronic stress has been associated with decreased lengths in telomeres and chromosomes, which indicates decreased lifespan. So we see this below the surface. We see this in our epigenetic work at this point, and there is reason for deep concern in terms of the impact of mental health of both of these pandemics on our young people as well. So what are we to do when we are positioned to support the well-being of our young people in schools, especially amidst this crisis? So that's what we're going to spend some time talking about today. And I want to first note that there are many things that we lose touch with during a crisis. And so many of us have been speaking about kind of what should we hold on to always versus what do we need to layer on now? Because during a crisis, even at the family level, we often see that families lose touch of some of their everyday rituals and routines. Yet one of the first things we try to do is to bring those back into play because we know how critical they are. So we want to remember there are some core principles and practices that our school social workers or other educators want to hold on to even during this time, including some of the core work that we do in school mental health. And there are also things that we need to layer on now during this very challenging and complex time. And on a daily basis, we are faced with new information about what the school year is going to look like, whether our young people and educators are going to be in front of screens or distance in schools. We know it varies from school to school, district to district, state to state, and it varies from day to day, causing tremendous uncertainty and worry and concern among young people and families. So in these times of uncertainty and challenge, we need to, again, hold on to certain basic principles and practices always that I'm going to touch on. And then we need to layer on some supports now. So we'll speak kind of across both of those levels. What do we need to continue doing that we've been doing? What do we need to stay the course with? And what do we need to add on now? And first and foremost, we want to ensure that we are encouraging self-compassion across our workforce. And by that, I mean our educators, our mental health professionals in schools. We know from prior community mental health data that when we have community or national crises, that our frontline responders, including our behavioral health providers, suffer some of the most devastating health and mental health consequences. So before and during our support for others, we have to remember self-compassion. And I know that there is a lot of information out there now about take care of yourself, use your coping strategies, but I'm going to say it again because when people feel stressed, they need coping strategies. And it is easy to let these go when we are trying in earnest to help others. So I do want to start and end with an encouragement for self-compassion. And this can include strategies like limiting how much you take in from the news and social media, maintaining your routine to the extent possible and engaging in healthy activities, intentionally relaxing, which can be hard as you are trying to support others, recognizing your own limits and knowing when you need to step back or to unplug, so to speak, engaging in healthy communications and seeking community. And this can be really hard during COVID when we are distancing. It's important to consider things like virtual check-ins and creating pods of family that you can communicate and engage with. Acknowledging how you are feeling and paying attention to and identifying your feelings. We do this with our young people a lot, our students, but we need to do it with ourselves as well. Get active, take a walk, play a physically distant sport, pick up an active hobby or a sport or something that you enjoy. And finally, surround yourself with safe, supportive people. So as we practice self-compassion, what can we be doing at the universal, and then we'll move our way up our public health continuum to support young people in this double pandemic? These are universal strategies that were present pre-COVID and should remain present and perhaps even more present as we restart schools. So we need to be focused on supportive, inclusive, positive school climates, and we need to be attending to that even through distance learning. How do we engage as a school community? How do we support? How do we first assess and then ensure that we have culturally responsive and trauma responsive policies and practices? And this may be with respect to school climate, it may be with respect to your discipline policies in your schools, maybe with respect to how you're ensuring engagement of young people through distance learning. We've seen increased interest in staff wellness over this time period, and we want to make sure that that's not just a moment in time, but that this is attended to throughout. Social emotional learning. This is something that more and more states have been adopting over the years, but we've now seen a transformation in this in terms of how we do this through distance learning. Crisis preparedness. We have seen many schools post-crisis say that they wish they had had better training in crisis preparedness. And there are a number of models. Some of those are listed here: psychological first aid for schools, a prepare model by the National Association for School Psychologists, and then finally mental health literacy for school staff and students. These are some of the universal strategies that we know are absolutely critical right now and cannot happen without school social workers at the helm. I want to make you aware of one resource that is coming down the pike that is attending to a couple of these areas that I just mentioned, and particularly mental health literacy for educators. So out of the SAMHSA-funded Mental Health Technology Transfer Center Network, in the fall of 2020, there will be a free online course that's put out for all educators across the nation on supporting mental health in the classroom. This will be about a 3 to 4 hour course with two main buckets on promoting the mental health and well-being of students, and that's really how to create safe and supportive learning environments that are inclusive and foster social emotional competencies. And then second, how educators can best understand and support students experiencing adversity and distress. We've also been working with the Central East Mental Health Technology Transfer Center Network to infuse a lens of cultural responsiveness and equity throughout these modules, but also to add on modules focused on school mental health, in terms of cultural responsiveness and equity. So all of that will be part of a package that's released in the fall. So wanted to make you aware of that resource. As I speak in a moment about some of the Tier 1 strategies that we are seeing in schools right now, I want to encourage all of you to enter into the chat what Tier 1 supports have been successful in your schools during this context of COVID-19. But I'd appreciate any innovations or supports at the universal level for all students that really speak to both pandemics that we're speaking to today. So please, whether it's a linked resource or just an innovation or practice that you've seen in your school or in your district, please go ahead and start sharing those in the chat box. So I want to speak for a moment to some of the Tier 1 innovations that we've seen across the nation. First of all, we've seen significant efforts to do the new 3 Rs. This was a term coined by Child Trends. They came out with a great statement early back in March or April, talking about the 3 Rs of reassurance, routines, and regulation. And I would say as we restart schools, we want to keep these in mind. First, adults should reassure children about their safety and the safety of loved ones and tell them that it is the adult's job to ensure their safety. Second, adults should maintain some routines to provide children with a sense of safety and predictability. And third, adults should support children's development of regulation. When children are stressed, we know their bodies react by activating their stress response. And so to help them manage those, it's really important that we validate their feelings. I know this might feel scary or overwhelming, and help them to engage in activities that can help them self-regulate, whether it's deep breathing or mindfulness or routines. So we want to make sure that we are attending to these routines and to support the regulation. We've also seen a number of systems doing daily or weekly well-being check-ins. I'll enter a few links into the chat box in a few moments with some strategies that schools are using. This can be as sophisticated as a platform where students go in and enter how they're feeling on a daily or weekly basis, but it can be as simple as a Google form where first period teachers, we've seen this across a number of districts, first period teachers are sending out a link to students and they indicate how they're feeling that day, how distance learning is going for them, who they need to speak to, creating pathways for young people to reach us. So what about how schools are responding at a universal level to our racial injustices across the nation? Many schools and school systems have released statements in support of youth of color and staff of color and the Black Lives Matters movement. I would say these vary in their level of commitment to feasible and sustainable and anti-racist action steps. And it is important that we show our support for our staff and students of color by going beyond these statements. And this statement by Dr. Tyrone Howard at UCLA, I found really kind of resonated with many of us. This moment makes it easy for schools to say that Black Lives Matter. This moment has made it comfortable for schools to say that racism is real and that they will stand up against it. But when the lights go down, will schools really do the really heavy lifting to examine school curriculum, which often excludes Black history, life, and culture? And so why is this important for school social workers? Well, we know that it is a very part of our ethics code and the work that we do to challenge social injustices as we see them. And in the individual work that we do with students and with families, we know, as we talked about earlier, that racial injustice leads to mental health impacts. So at all levels of the profession, it's critical that we are taking a stand and working to support anti-racist action for all students, not just those that we may be seeing individually or seeing their families. And so for many, learning about racist actions, ideas, or policies prompts the response, I'm not racist. When we know racism is harmful, it's difficult to accept sometimes that we may be a part of the problem. Being not racist means being neutral in a system that oppresses. A quote from Archbishop Desmond Tutu that many refer to: if you are neutral in situations of injustice, you have chosen the side of the oppressor. Being neutral is insufficient, we would argue, and in the words of Dr. Angela Davis, an author and activist, in a racist society is not enough to be non-racist, we must be anti-racist. But many of our educators and our school mental health clinicians have asked, well, what does that mean? What does that look like? How can I do this for all students? And so I'm going to point to just a few ways, and we know there are many resources and some that will be shared further today. So these were some put out by the National Child Traumatic Stress Network, specific ways that educators can support anti-racism for all students in schools. So learning about the impacts of history and systemic racism, creating and supporting safe and brave environments, modeling and supporting honesty and authenticity, honoring the impacts of history and systemic racism, encouraging and empowering students as leaders, and again, caring for yourself. These are crucial components of effective anti-racist teaching. And there are many organizations, agencies, and coalitions that are designed to support the anti-racist work in schools. And this is one that some of you may be familiar with, Black Lives Matters at School. It's a national coalition organization, and their 4 demands are: first, to end zero tolerance discipline and implement restorative justice; second, to hire more Black teachers; third, to mandate Black history and ethnic studies in the K-12 curriculum; and fourth, to fund counselors, not cops. And I recognize that some of these may be controversial, and again, opinions on these vary, but there are actions that our school mental health clinicians and educators can do to better support the anti-racist movement in schools and to support specifically our young people and staff of color. Other organizations include some of those listed here. We work closely with the Coalition of Schools Educating Boys of Color, and their mission is to connect, inspire, support, and strengthen school leaders, and is dedicated to the social, emotional, academic development of boys and young men of color. Some of you may be familiar with others here: Teaching Tolerance and Center for Racial Justice in Education. And these websites alone provide a great variety of resources to help you and your school improve anti-racism efforts. And then one more area that I would say at a universal level can be really important for educators and school social workers and mental health professionals to consider is to support youth in their activism and in their engagement in their community. That alone is an act of mental health support. I will point you, and again, I'll put some of these links in the chat box, but I'll point you to what I found to be a really useful article targeting adults to challenge our own assumptions about what youth can and can't do as far as activism and being ready to learn, and how we can offer our own resources and work to support young people. We have seen tremendous planning across schools and state departments of education as we re-enter this new school year. These are just a few sample plans or strategies at Tier 1. So evaluating staff mental health readiness using surveys. How are staff doing? How are they prepared? What are the referral mechanisms that are in place? Providing resources for staff self-care, including resiliency. Normalizing feelings through forums and spaces for compassionate listening, where students and school staff can share, discuss, and process their common experiences. This is relative to COVID, but I would say the same for their experiences related to racial injustices. Mental health professionals and educators co-teaching social emotional learning strategies. This is showing up in a lot of our state and district plans. So we're going to move our way up in the last couple of minutes to what we can be doing in our tiers 2 and 3 to support young people. And I'd encourage you now to go ahead into the chat box and enter in what supports have been successful in your schools at tiers 2 and 3. And I want to emphasize again that there are many efforts that have been in existence pre-COVID that we would encourage schools to continue. Some schools have actively been doing well-being check-ins with students, and that's not just a one-time universal screening, but sometimes more of a progress monitoring of well-being. And we also know there are a number of evidence-based psychosocial interventions that have been delivered to support students and may be more critical now than ever. One thing I want to emphasize in terms of screening or well-being check-ins is the shift away from just assessing pathology, away from simply asking, how sad have you been in the last 2 weeks, but really looking for strengths. We know that when we assess subjective well-being and things like connectedness to school, it actually does a better job of predicting student functioning. One example of this that we have seen as quite a success is from some of our colleagues at University of California, Santa Barbara, You can find them at Co-Vitality, and it explains this concept of why we need to be thinking outside of screening for pathology. And then just want to mention again why the work that you do in schools is so critical. This is some data that I won't go into great detail, but this shows us that after Hurricanes Katrina and Rita, when trauma-focused interventions were implemented in community mental health settings versus in schools, young people were far more likely, in fact, according to this data, 6 times more likely to complete mental health treatment when it was offered in schools versus when it was offered in community settings. And we have a number of studies that demonstrate similar trends. Providing mental health supports in schools is absolutely critical to young people accessing care. We also know that now more than ever, we cannot just be focused on addressing COVID. We've seen a number of school plans asking about how is your family impacted by COVID? And I would argue that we have to, as school systems, also be asking about and supporting young people, especially our Black students and staff and others of color, how racism and social injustice is impacting them and how their experiences with Black murders and uprising is impacting them, both in terms of how it may bolster some of their community, their strengths, but also what are some of the mental health impacts that need attending to. These are some of the things that we've been working with our school mental health teams to consider. How is cultural responsiveness integrated into the interventions that they are using? And if it's not, do we abandon some of those, or do we better weave it in? Acknowledging racial trauma and its impact. And if we're not doing that in our work, we are not providing culturally competent care. Validating reactions of young people, promoting healing by processing the pain of racial trauma, and supporting self-compassion strategies for responding to the toll of trauma. And I also want to encourage us all to be thinking about not just as systems, how can we support the negative mental health impacts of institutional racism, of different levels of racism, but how can we celebrate the strengths of young people through intervention. This is one example of many that are looking at how can we as mental health professionals lift up the strengths of people of color, of youth of color. In terms of now, what we're doing now in schools, our tier 2, tier 3 strategies, given a distance learning environment, many are having to work through a tele-environment, but we have seen tremendous innovation here in terms of adapting structures and using web platform features. One of the best resources I've seen is right in your backyard, the Center for Childhood Resilience, based in Chicago at Lurie. They have provided a number of resources to deliver tier 2, tier 3 interventions virtually. So I encourage you to check out some of what they have available on their site. In terms of some of the plans that we've seen in the school year planning at the state and district levels, we've seen encouragement for screening. Again, I want to encourage you to think outside of just the COVID box and just the pathology box to what are some of the strengths that our young people are bringing with them. And then tier 2, tier 3, what are we doing to support our educators in terms of identifying signs and symptoms of mental health distress and providing clear referral procedures, communicating counseling support services available to students. I was on a panel last week of students who said, don't wait for us to come to you, you need to come to us. And that is true probably more than ever in the distance learning environment. It means not just waiting for students and teachers and parents to reach out, but rather creating pathways, whether it's the well-being check-ins or phone calls from our counseling and social work and administrators. And at the end of the day, we kind of loop back to where we started, which is compassion and compassion first. And that should start with compassion for yourself and attending to the relationships. We always speak to the idea that health and well-being has to come first, along with safety, before we can attend to academics and instruction. There is some national awareness of this, but one of the things that we can do collectively is really be ambassadors of our student and staff mental health right now. And so I look forward to joining you for the rest of the morning and hearing about the good work that you all are doing. You're welcome to reach out to me today and beyond, and I'd love to hear about the innovations that you are using in your communities to support young people's mental health and well-being. So thanks so much.
Thank you so much, Dr. Hoover. Annette, I hope it's okay if I just jump in here. Wanted to see if there are any questions. The majority of the questions that came up, well, there weren't too many questions that came up, so I'm going to encourage you guys and give you a minute while I'm talking to be able to drop any questions that you have down in the chat. I think the biggest one that came up is people want to make sure that they can get this information again. So we are recording this session, and Annette can tell you either now or later when that will be available. People are also asking whether or not there will be slides that are available. So I don't know if you need both or either or what have you. But please, as I'm talking, if anybody has any specific questions, please feel free to stick them in the chat. One of the comments that, and I'm just going to jump in here. Thank you so much for your information. Thank you so much for being here. We really appreciate it. I'm just going to jump in really quickly. And so really a lot of information that I appreciate with regard to both crises, and particularly the racial injustice that's been, as you acknowledged, ongoing. The connection that you made between experiences of racism and oppression that have impacts on mental health and well-being, which is very well documented in the literature, but not often talked about so much. So I appreciate that you really highlighted that and pulled that out. Terry Solomon put a comment, not a question, and let's see if I can go back and find it, because I called myself copying and pasting, and of course I don't see it in front of me, so let's see if I can try it again. But the basic comment said something along the lines of, I can't find it. Let's see. It basically says along the lines of that racism impacts the entire school, right? So if we think about things from an ecological perspective, everything is connected, and so we have this very needed, and I'm adding to what Terry was saying. So I have this, thanks, Veronica. Racial trauma is an issue for all students, not just students of color. Racism affects white students too. And so that was kind of spearheading into what I was thinking, and the question that I have is that all of the students are impacted. Racism is something that is not of the students that are being impacted, right? And so what I'm wondering about is interventions or thoughts around how we can support the entire school to change the culture of that, because when we think about interventions, we often think about individual level interventions, and while they are needed, and you talked about tiers and stuff, there's also the importance to address the actual environment in which we are residing, right? So we think about how the students treat each other, about how racism is perpetuated even when we don't want to think so, but by administrators, by our policies, by our teachers. And so this process of self-reflection, but also just on an intervention. I was wondering if you could speak to that a little bit, please.
Yeah, so it's a great point. And I think, in terms of the statement that was made, racism affects white children too, I think that could probably be taken two ways. And I'm going to understand it as racism affects all children in a negative way, in that we know that racism impacts society collectively, and that it is not good for anyone, and that we are all, if we are not being anti-racist in our work and in our engagement with our community, that we are contributing to the problem. So how do we address that kind of at a collective level? The good news is there are a number of resources, some of which I mentioned. I'll go ahead and share some links in the chat box that can help have young people of all races begin discussing race and racial differences at an early age, acknowledging white privilege and bias, and that racism exists, doing that through the curriculum, making sure that young people have positive experiences and exposure to diverse groups of children. That has a profound impact on young people's understanding of race. Helping young people through our curricular efforts in terms of them critically thinking about racism and bias and stereotypes. Sharing stories of people of color throughout the curriculum, and not avoiding tough conversations. Again, I think some of the resources that I shared speak to this quite well, and I've seen some in the chat box as well. So Gisela just pointed out children's books on race and racism. Fabulous. These can be integrated at home, supporting our families on having these conversations. We've been doing a series of community conversations through our work in Baltimore around how can families talk with their young people about these topics. So I know that we're just scratching the surface here, Dr. Doyle, but there are a number of resources. And again, I'll go ahead and start copying and pasting some myself into the chat box. But we do, I should point out that we have a page that we've had on our site for quite some time on cultural responsiveness and equity, but we've been populating it with resources for educators across the school and district level to support this issue. So I'll go ahead and stick that in the chat box.
Thank you.
Mm-hmm.
And I think I'm just gonna start speaking. I'm pretty sure Annette doesn't mind. So there's a question from Renee Green to the group that says, can you speak more about the resources you gathered from Lurie about interventions for schools?
Yes, so Lori's Center for Childhood Resilience has been doing a fair amount of tier 2, tier 3 supports in Chicago and throughout Illinois, and they've put out some guidance documents on how to conduct tier 2 groups, for example. I'll go ahead and stick that into the chat box here. It's a bit of a long link, but this is a guidance document for conducting tier 2 groups. They have been doing, and I saw a couple of people in the chat box saying that they're doing things like Bounce Back or CBITS or Sparks in your schools. This is a facilitation guide that goes kind of session by session as to how you can transform those through virtual learning. So a number of clinicians across the country are turning to those resources and really trying to transform the care that they're doing through virtual.
Go ahead.
Thank you so much. Another question that came through the chat was, how can you support educators and other adults during the double pandemic?
Mm-hmm. Mm-hmm. Yeah, and so, sorry, just sticking another link into the chat box there. So, I think that is aligned with kind of our first discussion point around self-compassion. We know that our educators and our parents need to be attended to first. We can certainly speak simultaneously to supporting young people, but if we ignore the educators and the parents, the children's well-being will suffer as well. And so, for our educators, for example, having shared decision making, I should back up and say we can't just, we have a quote that we often throw around within our team, which is, please stop telling me to do more yoga. I'm a big fan of yoga and mindfulness, but we have heard from teachers specifically, you can't just keep telling me to do my, walking Wednesday or my yoga Tuesday. We need institutional or organizational policy and practice change that supports well-being and care. And so I think thinking beyond self-care strategies is really important for our adults. And that means for our educators, for example, giving them shared decision-making opportunities, having them be at the table when decisions are made around how to do distance learning with students. There was a very strong report put out by the American Federation of Teachers that some of you may have seen last week, calling for what needs to be done to support them through this very complex time. I'll go ahead and put that link into the chat box. So it's kind of self-care plus. It's how do you create organizational strategies? And, we have check-in, check-out for students. There's a similar tap-in, tap-out that's being implemented in a lot of schools now where educators can say, I need to tap out in my classroom right now. I need someone to come in and step in. I need to take care of myself. And in particular, we need to be looking for how our Black colleagues are impacted right now and what we can do to be supportive. In terms of either decreasing workload or supporting their social emotional well-being in ways that we may not have considered before. So I'll leave it at that, but there is so much that can be done.